A lot of people wonder what it's like to go through the process of having a facelift and facial cosmetic surgery. And so what we're going to do today is we're going to take you through the process from your consultation all the way through surgery and all the way to your 3-month follow-up when we take your after photos. The thing that has people come in for a consultation regarding a facelift is I believe that eventually we all look in the mirror and what looks back at us is not what we feel like we really are inside. So the face doesn't match the youth that we feel inside. And we want the outside to match the inside. And so what happens is people get older, flaws show up in our faces, and we want to take the mask off and reveal the real us underneath. It takes a lot of courage to even make the phone call. You think about it for a long time. It can take years for people to decide to have cosmetic surgery. Some people come in for the thing, they're bothered by their neck. Some people come in with a direction they want to go. I'd like to look younger and fresher. And those are two different conversations, of course. If you are just interested in the thing, that's what we focus on, but it's an opportunity to look at your whole face. Some people come in and they want to focus on their neck and their cheeks, and they only want to focus on the bottom half. Some people come in and they only want to focus on the eyelids and they want to do the top half. But the questions are all similar. It's about what can we accomplish? What is it that you want to do? Because you're the senior partner in the relationship, and every face is different, and it's all custom designed based on your anatomy and what you want to accomplish and what you're willing to go through. And so once we decide what it is that you want to do, then we put you on the schedule for your surgery and your pre-op visit. So we schedule a time for the surgery, and then before that we have a pre-op visit. At the pre-op visit you come in and we do things like we take your pre-op photographs, we have you read and sign those scary consent forms, we write all the prescriptions that you're going to need for your surgery, so that the morning of surgery we don't have any of that stuff to do. The morning of surgery then it will be your next appointment after the pre-op, and so the morning of surgery you come in, and what we do is we take your blood pressure and we're getting you ready for surgery. You'll see the anesthetist, you'll see me, we'll go through the list, we'll make certain that we got it exact, I'll ink you up. And then what happens is after we are certain of every little detail, then we walk you to the operating room. The anesthetist starts an IV in your arm, and for the patient, it seems that quick. You're getting in the car and you wake up and you go, when are we going to do it? And it's over. We wheel you to the car, or if you would like, you can spend the night in our facility. We have an overnight room with a nurse. If not, you go home with your support person, and I call and check on you at night, and we see you back very first thing the next morning usually, and we unwrap you and make sure everything is the way we left it. If everything is good, like it usually is, then you can go home and get in the shower and get it soapy and wet if you want to, because soap and water won't hurt it. What I look for on the first day post-operatively is I look for symmetry. I want to make certain that one side of the face is not a lot more swollen than the other. If it bleeds underneath the skin, it will swell. If that happens about 1% of the time. And so I'm looking for those little things. I'm also looking for the color of the skin, to make certain that it's getting good circulation and that it's going to heal well, and just the overall everything and how you're doing. And so if everything looks good, like it almost always does, I can send you home, and we would see you back 5 or 6 days later to get out some sutures. And we see you back then, and then we see you back usually on the 10th or 12th day to get the rest of all the sutures out. And then we probably will see you back at a month after that, and then a couple of more months after that to take your post-op photos. I generally think that at 3 months you look really good, even though you might not be totally finished with it. But we think that at 3 months you look really good enough, and we take photographs then. I guess scars will improve sometimes for a year or more. And so those little things sometimes can take a little longer. But you get a beautiful result by 3 months. Some people get a beautiful result by a month. And depending on what you do, some people get a beautiful result before then. It just depends on how you heal and what exactly you had done. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.